morning, Speaker. My question is for the Premier. A veteran approached me after Remembrance Day ceremonies in Guelph last Thursday. His eyesight has declined, and he desperately needs access to an optometrist, but neither he nor his grandkids can make an appointment for eye care. Speaker, it's wrong that seniors and children cannot access eye care in Ontario. It is wrong that optometrists lose over $30 for each OHIP eye exam. So, Speaker, on behalf of this veteran and thousands of people across Ontario, I'm asking the Premier, will he do basic math and cover the full operating cost of delivering an OHIP eye exam in this province?
Minister of Health.
Thank you, Speaker, and thank you to the member for the question. I can certainly agree with you that it is wrong that people are not receiving the services that they need to receive quality eye care. That includes seniors, that includes people under age 18. But the Government of Ontario is ready, willing and able to pay for these OHIP-covered services. Sadly, the Ontario Association of Optometrists is not. Now, I think it's very important that anybody who needs eye care should know that the College of Optometrists requires the optometrist, even if they are not providing the care themselves, for someone that needs urgently required health care, the college says that the optometrist must refer them to someone who will provide that service. That is important for everybody to know, to first discuss it with your optometrist and then get a referral to somebody who can help you. However, I think it's also important to say that we are ready, willing and able to sit back at the table at mediation with the association. We've asked them to do so several times. We've made a $39 million payment into their accounts already. We're ready to increase their fees by 8.4%, retroactive to April 1st, and we are ready to sit down and have a working table today, if they're willing to go back to the table, to talk about their overhead costs. We know that they have been put back by previous governments. We want to make it right with optometrists. We want them to come back to the table so that we can continue to provide those services.
Thank you very much. Thank you very much. The supplementary question.
Speaker, with all due respect to the minister, I ran a small business for many years. You cannot have your business continue if you're losing money on each exam. So yes, the government says they will continue to pay OHIP eye exams, but if you're losing $30 every time you give an exam, how can you continue to do that? The government says we've offered an 8% increase. So that means instead of losing $30, they're losing around $27. It's still not sustainable. And the minister says the government is willing to negotiate. I say it in the House, I said it on social media. So it's my understanding that the OAA president has provided the minister through a letter his cell number to begin negotiations. So my question to the minister would be, can the minister inform this House and the people of Ontario how many formal outreaches have been made to the OAA through a letter or a phone call asking them to come to the negotiating table since September 1st when services were withdrawn?
Thank you. And to reply, the Minister of Health.
Thank you very much. I would say the answer is many. As I mentioned in the letter that I received from the Leader of the Official Opposition and the President of the OAO, they asked me, in my capacity as Minister, that you direct the Ministry of Health to immediately commence intensive negotiations with the OAO concerning OHIP optometry fees. Further, the negotiation process must include a mediation and fact-finding process that results in a public report in the event that the parties are unable to reach an agreement. We said yes. We honoured the OAO's request to commence mediation only to have the OAO reject the mediator's terms and walk away from the table. The Ministry of Health has agreed to the conditions required by the mediator to resume negotiations and is ready, willing and able to continue those discussions with the OAO. But I would say that given the OAO's engagement of legal counsel to support their negotiations and the mediator's regular outreach to counsel to explore the continuation of our talks, the OAO is very well aware.
Thank you very much. The next question.